We'll go ahead and get started. Tonight, I'd love to welcome everyone to this evening's Meet a Pro session. We're very happy this evening to welcome Dr. Karen Jordan, who is a small animal vet in Atlanta, Georgia, and she is honoring us with her time this evening. I will go ahead and let her do an introduction, and then we will dive into some questions. We're going to do a little bit of a back and forth. I have some pre-prepared questions, and then I have the questions that were submitted in advance through the registration form. So we'll go ahead and get started. Dr. Jordan, if you'd like to introduce yourself.
Okay, very good. Thank you. Hello, everyone. My name is Dr. Karen Jordan. And like Jennifer said, I am a small animal veterinarian. Small animal veterinarian typically means what we consider our companion animals, cats and dogs. Every once in a while, I'll see a pocket pet, like a rabbit or something like that, but mainly I do small animals, dogs and cats. I'm a little different in that I am what is called a mobile veterinarian. So I don't have a brick and mortar clinic where people bring their pets to me. I'm a mobile veterinarian, so I come to people and I take care of their animals in their home. I'm also a little different because I also studied veterinary acupuncture. So I do acupuncture on animals and it helps them with pain. It helps them with diabetes. It helps them if they have kidney failure. So a lot of cats and dogs don't take or cannot, they don't like a lot of medication. So I use acupuncture to help them manage their diseases. I use it a lot for big dogs with arthritis. Um, and I love veterinary acupuncture. That was something after going through my veterinary career, through 4 years of vet school and an internship. Then I decided I wanted to learn veterinary acupuncture. Um, and it's the sky's the limit with veterinary medicine. There's so much that you can do to continue to educate yourself, and I call it recreate yourself as a different version of a veterinarian. So that's who I am.
Wonderful. I actually have a very close friend who takes both of their animals to a holistic vet, so a fully holistic vet. So it's always nice to know that there are other options out there for
Yes, I
for
agree.
treatment. Well, the first question that I would love to ask is this something you always knew you wanted to do, as long as far back as you can remember?
Yes. I'm one of those, I don't know if I'm rare, but I'm one of those people, probably from the time I was 2 years old, I knew I wanted to be a veterinarian. And that is all that I wanted to do. That's all I wanted to be. There was no alternative career choice for me. It was, I, I don't even know where it came from, but I wanted to be a veterinarian. And so once I reached that age where I could start to see what that looked like, I put myself into positions where I could be in a clinic or volunteer in a clinic or clean the kennels or do something to see, do I really want to do this? And the more I did it, the more I realized I can't imagine doing anything but this.
I love that. I wish I had had that clarity of vision when I was growing up. Um, was there anything that you maybe didn't do when you were in high school in terms of like preparing for this career that you wish you had done? Or what did you do while you were in high school that you feel helped propel you toward this career?
I don't think there was anything that I didn't do. I really gravitated towards all the science courses. So I wanted to learn chemistry, and I wanted to do the biology and genetics, all of the science courses. I wanted to get as many of those as I could. Um, I don't think if I had to, there's nothing I would do over. For me, and again, I'll age myself because I graduated in 1984. So when I graduated, uh, things were a little different. So I did not have, I didn't have the guidance that said, you need to stay on this track, or you need to make sure you need to take care of this or take care of that. And so I went about it myself so that when I applied to vet school, I realized that there were courses that I had not taken, that I had missed. So even though I was admitted, I had a little bit of a heavier load because I had to take those courses at the same time as I was taking my veterinary courses. So if having someone that like guides you and helps you understand, so these are the courses, these main courses you have to make sure you have, because when you apply to vet school, they're going to ask if you have taken them, and if not, it's going to add to your course load. Um, but it
Do
worked out.
you mean courses that you take in college or?
Yes. So these were courses in college. So, but even in the high school realm of things, unfortunately for me, I was not, I don't want to say I was not encouraged, but in some ways, I was not encouraged to pursue my career. And it was mainly because I was told, well, you might want to think about doing something other than veterinary medicine. And quote, because there are not a lot of Black people in that field. And that put a fire under me. It's like, really? Okay. And so it didn't deter me. It didn't make me say, oh, I gotta think about something now. What it did was, hey, you know what? This is what I want in life. This is what I want to do. This is what I'm going to do. And so I took up taking care of what I thought I needed to do. When I got to college, I took the coursework that I needed, and it wasn't until I was applying to vet school that I realized, oh, I missed a couple of courses. So even at that level, while I was at college, um, I didn't have enough guidance that says, don't forget this, don't forget that. It was just a little checklist I was going off of as to what I thought I needed.
Good, that's good to know. Um, I think the guidance that students have today really didn't exist. I graduated from high school in 1989, and I think if my counselor hadn't been my track coach, I would have never met him. So,
Yes, I
how
know.
did you decide which college to attend?
For me, it literally was, um, there were two things. One, I would say the most pivotal thing was, I think I must have been junior high school, had not even quite gotten into high school. And at the time, we had a family pet. And my dad took me to a veterinary clinic in Baltimore to meet this veterinarian. And it was a Black veterinarian. And I met him and I spoke with him. And he said, you know what? You need to go to Tuskegee University. I had never heard of Tuskegee University. And as soon as I heard you need to go to Tuskegee University, that became my drive. I need to go to Tuskegee University. And to this day, Tuskegee University puts out probably 70% of African American veterinarians. And so going to
That's
Tuskegee
an
University,
incredibly impressive statistic.
yes. And going there, just, it was like, not only did I want to be a veterinarian, I wanted to be a veterinarian that graduated from Tuskegee University. And so that was, there was no other college that I wanted to go to. It was, I want to go to Tuskegee. And so having met that man, unfortunately, I can't say that he mentored me because he was a little further from where we lived, and I found other clinics around to, get that mentorship. But just his presence and that one meeting changed the trajectory of where I was going to go and how it was going to happen.
It's so interesting how our lives, the trajectories of our lives, can be
Yes,
altered and by chance meetings like that. It's so interesting.
I agree.
Did you stay at Tuskegee all the way through your doctoral program,
I
your
did.
grad
So I did
school?
my undergrad work. Actually, my undergrad work was at, trying to remember what it's called now, Towson State. I think it's Towson University now. Okay, so it was
Yes,
Towson
Towson. My
State.
daughter went there.
See. So that's where I did undergrad. And then I went to Tuskegee for the doctorate in veterinary medicine. And then when I finished my doctorate in veterinary medicine, I did an internship in small animal medicine and surgery, and that was at University of Tennessee. So I furthered my education because at the time I wasn't sure if I wanted to specialize, and if so, you needed to complete an internship before you could go into a specialty practice. So I did. Tuskegee to me, and it's weird, but Tuskegee's my alma mater. Yes, I went to Towson, but Tuskegee was that family close-knit university. It was they embraced me, brought me in, and forever that's my true alma mater. So
I love that. That's beautiful.
thanks.
Um, I think I'm going to move now into some of the questions that were submitted from our registrants ahead of time. So the first of those questions is just, what does a veterinarian do on a daily basis?
Okay. Well, I'll answer it in two ways. Um, First of all, I'll say, what type of veterinarian are you asking about? Because veterinarians, we are not just small animal veterinarians like myself. We are not large animal veterinarians that, take care of horses, cows, pigs, farm animal medicine. We are also public health veterinarians. We are also research veterinarians. We're zoo veterinarians. We're exotic veterinarians. In every aspect, um, veterinarians infiltrate more than you realize, especially when we get into public health. Okay. Um, a lot of what happens with animals that, those who eat meat, those animals, it is a veterinarian working with at the state level with those inspectors to make sure that what you're eating is safe. So a day in the life of a veterinarian really depends on what type of veterinarian you are. I knew I wanted to be a veterinarian, and I kind of thought I wanted to be a small animal veterinarian. So what I did was I went out and tasted veterinary medicine. I did a summer learning research. What does research veterinary medicine look like? What does being a lab animal veterinarian look like? Um, then I tiptoed into um, with research. It was a little more than I wanted, so I knew that that wasn't it. I did zoo animal, and each time I got a taste of what different fields of veterinary medicine looked like, it helped me to really just narrow in what field did I want. And so I chose small animal medicine. So for me, again, since I'm not a traditional veterinarian that has a brick and mortar clinic that people come to, my day is I drive around to people's homes, seeing their animals, taking care of their animals every single day, and I love it. A lot of the patients that I see um, are either challenged where they can't get out the home, where the owners are older and they can't get out the home, or have pets that are just too scared to leave the home. And so for me, my day starts out um, pretty much putting together a schedule that allows me to see the animals that don't get seen that need to be seen. And it's so many people have cats or dogs that they can't get into the veterinarian. And so the clinics will call me and say, hey, and everybody calls me Dr. J. They're like, hey, Dr. J, Miss Jones has a cat that she can't get from under the couch. Can you go see the cat? Ah, yeah, I'll go see the cat. And so I love that aspect of veterinary medicine. Um, I love being around people. I love, interacting with people. So being a mobile vet going to people's homes gives me that opportunity where the clinic is a little more too sterile. I like to be able to just be myself.
Such a unique experience. I don't think I've ever actually, I had met a travel vet once who helped us at one time we had to go to the emergency vet, and she explained that that was what she did. And it's just such an interesting experience. Like you talk about travel nurses and travel, but it means something different, I think. It sounds like it means something different in the veterinary sphere
Yes.
because you're going into people's homes and not, yeah. Um, okay. So I think the next question, I think you've already answered. What types of animals do veterinarians usually work with? And you have touched on that a fair amount.
Yeah.
But the next one is a pretty good one. What skills are important for being a veterinarian? What do you think makes someone a good doctor of animals?
Um, I think probably the most important skill is communication. Okay. Followed by observation. And the reason those two go hand in hand is I think of veterinary medicine or being a veterinarian like being a pediatrician. And by that, I mean, I need to be able to communicate with an owner. A pediatrician needs to communicate with a parent. I need that owner to tell me everything that I need to know about that pet, down to the most minute detail, because my patients can't talk to me. Now, along with that is the observation. I also need to be able to observe. Okay, let me see this dog walking. I see that limp. What do you have on your fur? You've been chewing. You've been doing that. What's going on with your ears? It's using all of your senses and being able to formulate at least a tentative diagnosis as to what you feel is going on with this animal. So communicating with owners and being able to let them explain, ask the right questions, because what I've learned, even now, I'm learning more as I expand upon um, learning different aspects of veterinary medicine, that in order to truly help or heal a pet, I have to know from an owner every clinical sign that they see, because I can diagnose a disease incorrectly based on an assumption. And so listening, observing, and being fully present with a client gets you everything that you need. So to me, those are the three most important skills as a veterinarian. Um, I used to do surgery and I love surgery. So the other skills to me is working with your hands, um, being able to feel, palpate again. Hands are another good sensory organ that people don't understand, don't use often enough. I think the only other skill I would have to say is just remembering that animals, they communicate in a different way. And so being open to how this animal's communicating to. And it's like I say, if whatever I bring, I receive. So if I bring kindness, compassion, and love, that's what I'm going to get back. If I bring fear, I'm scared of that dog, I'm going to get that back. So watching your body language and how you approach will always, in return, you'll get what you're looking for. At least that's how I work, and that's what I found.
That's very, very well put, very eloquent. Um, Next question is, what is the difference between a veterinarian and a veterinary technician? That's a very good question, I think.
Okay, so it is a very good, very, very good question. So let's start with a veterinary technician. A veterinary technician, um, depending upon where you live, so like here in Georgia, there is, I think there are two, actually, there are two veterinary technician schools. And these young men, young women and men, they go to school to learn veterinary medicine, but it's almost like going to nursing school. Okay, so a veterinary technician is licensed, and they are licensed in such a way that, yes, they place catheters, yes, they draw blood, yes, they assist in surgery. So everything they are sometimes called veterinary nurses because that is exactly what they do. So the veterinarian, so when I worked in the clinic, I would tell my veterinary technician, I need you to do this, 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 and this. And they would be able to go and do that. And they did not require supervision. Or they would do the nursing care and they would come and tell me, hey, doc, I'm seeing this, 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 and this. Having a license to do, or being a licensed veterinary technician allows you, it just affords so much more opportunity, because I know of some veterinary technicians that they work in veterinary surgery fields. They work in internal medicine fields. They work in veterinary radiology. Okay. The knowledge base is broad. There's a young man that actually he has his own mobile veterinary technician practice. And I work closely with him so that some of my patients that need care that I really just don't have time to give them all the time, in terms of he needs fluids, he needs this shot, he needs that shot. I get to say, and his name is Yona. I'm like, hey, Yona, these are the patients that I need you to take care of for me this week. And because he's licensed and he's a licensed veterinary technician, he goes and does the work that I can't get to, but we take care of the patient, and he basically gives me my files and gives me my reports and lets me know everything that's happening. That is a shorter program, about 2 years. A veterinarian, you're looking at 4 years of undergrad college and 4 years of vet school. And that's just to get your DVM. If you want to go further, then you're looking at an internship and a residency. So it's a long process. And veterinary school is not as easy to get into as one might think. It's starting to expand in terms of the number of schools that are, or there are more schools now than when I tried to get into vet school or when I got into vet school. But it's very competitive, very competitive. But don't let that dissuade you. It is a difficult
I've
profession.
heard that. Also a lot harder because you're not learning the structures and functions and parts of one species. You're learning so many. So I think
It is.
it's a lot harder, I think, than being a people doctor.
Yeah,
No offense to people doctors.
no, you
Need them
guys
too,
learn
but-
humans, and that's it. Even though I knew I was going to be a small animal veterinarian, I still had to learn large animal medicine. I still was tested. I still had to pass my board exam on large animal medicine. And that's the difference between, again,
Wow.
a veterinarian is like every species you
goodness.
have to know, and you will be tested on, and you have to pass your boards on, even though you may never touch them after you leave vet school. That's why
That's
it's a rigorous training. It is hard, but it is rewarding. And if this is what you love to do, it's the best thing you can do.
The next question is, what safety precautions do vets take when handling animals?
I think that for me, the biggest safety precaution always is going to be around dogs. And the safety precaution that, again, this goes back to communication. The biggest safety precaution is asking, is your dog fearful? Is your dog, and there's a kind of a fine line between, is your dog fearful or is your dog fearful and will bite? Okay. In this day, in this age of veterinary medicine, we're learning something that's called fear-free clinics or fear-free practices, where we are trying everything so that we don't have these fearful dogs come in that unintentionally or intentionally out of fear, protective, bite out or snap at not only us, but at the owners because they're scared in this room. And so working through fear practicing, or I should say, working with behaviorists, animal behaviorists. And yeah, that's another side of veterinary medicine, believe it or not, veterinary behaviorists that I do send patients to. And yes, there are some veterinary patients that need to be on medication. And so those are the ones that we learn how to navigate through so that we stay safe. And the same thing with the animals is keeping the animals safe. Some of them do require sedation because they are what we call untouchables. No matter what we do, we just can't touch them, and so we have to sedate them to touch them. I have a lot of patients that require oral sedation, so before I come see them, they have to be medicated, or else I can't touch them. And it's not just dogs, it's cats as well. And on the large animal side, it's the same thing. Everything is about the safety of the animal, but also our safety, because things can turn in a moment and you have to be prepared. So a lot of times you assess the situation. We make sure that the minimum number of people are in the space where they need to be for an animal that is fearful and potentially aggressive. And for those, we manage them with, a lot of times it's what we call chemical restraint, which means we're going to have to give you sedative before we can touch you and work with you. And that actually, it works out really well as opposed to trying to wrestle a dog down and it ending badly.
It makes a lot of sense. I mean, and again, going back to the fact that these animals can't talk to you. They cannot verbalize what is hurting them and what is bothering them. And so, thinking about how things can turn in a moment, that's going to be a very impactful part of it.
Yes.
What do you think are some of the most common health problems that you treat when it comes to, say, just for your experience, cats and dogs?
So the most common health problems that I treat definitely, well, here in Georgia, a lot of skin abnormalities. A lot of dogs have allergies, just like humans have allergies. Dogs have inhalation allergies. So it either manifests with like horrible um, runny eyes, runny nose, sneezing. So food allergies, inhalation allergies, and then they start losing their fur. And, then that kind of escalates into a whole different realm. By that time, I've referred them to a veterinary dermatologist. And yes, we have veterinary dermatologists. And just like people get allergy shots, dogs get allergy shots. And so see a lot of skin cases. I deal with a lot of large dogs and the older geriatric population. So what I see myself, a lot of arthritis, a lot of dogs that are very athletic, but they end up with knee injuries, cruciate injuries. And then, of course, with cats, most of the cats, if I was to say cat problems, unfortunately, chronic kidney disease, diabetes, and thyroid disorders are the three most common things that I treat in cats. With dogs, it tends to be more orthopedic. And then part of learning veterinary medicine is learning different breeds because there are several breeds that have what we call genetic predisposing factors. And some of those breeds are our favorite breeds. Like for me, I love golden retrievers, and golden retrievers have a genetic predisposition, unfortunately, of having cancer. Boxers have the same. German Shepherds have a predisposition of having hip dysplasia. So those are the things we treat, but when you know about it, then for me, it allows me to educate an owner. If you're going to get this breed, I need you to know everything about this breed before you decide to adopt or before you decide to get this dog, because these are the things you're going to have to address.
I have two golden retrievers at my feet right now, by the way. I think you've touched on this next question a little bit so far, but maybe you could dig in a little bit more to like, how do you diagnose an illness in an animal, given that they can't talk to you? They can't say, well, my stomach hurts, or, I mean, you must have to go through a lot of other circuitous routes to figure out what's wrong.
Again, it all starts with that initial physical exam and the intake with the owner. So for me, my intake is probably about 20 to 30 minutes before I even touch the animal because I need to find out everything from what they eat, drink, their bathroom habits, their sleep habits, clinical signs and symptoms. Once I have all of that information, then I go into my physical examination. And I say from the tip of the nose to the tip of the tail. I examine every square inch of the body because, again, it's what you miss by not looking. That could be that key sign or symptom that you need to know to help you diagnose. And so I make sure I hit every body part. Once I've gotten a physical exam and I'm comfortable with the information, then I move on to the next thing that says, okay, well, I don't like what I'm seeing here. You're drinking much more water than normal, you're losing weight. We're going to run some blood work. And so I'll get a blood panel. And based on the blood work, that'll help direct me as into, which disease or diseases I may be dealing with. And then do I need to do something further? And then the further would be diagnostic testing, like, does he need x-rays? Does he need an ultrasound? What else does he need? And then once we have this full picture of whatever the disease is, like cats with chronic kidney disease, I put them on a special diet. I put them on fluid therapy. I put them on nutritional supplements. And I make sure I see them at least once a month and just kind of keep monitoring and checking in. And the same with, dogs that have thyroid issues. It's not just one-stop shop. With animals, you have to see them more often or more frequently because they can change and owners not notice, and then we can find them in a worse state.
It's wonderful. Um, what would you say are the most challenging and rewarding parts about being a vet?
Ah,
Probably a hard question, but
You know what it is? Okay. Um, I think for the most challenging for me is people who love their animal but can't afford their animal. Um, that's and it's the challenge is a lot of these animals end up having a disease or an illness or a trauma that is unaffordable. And having to navigate through, well, what can we do? How can I make this more affordable for you? How can I make this happen? How can I make that happen? So it's hard to be in a position where you feel like I can help, but I can't help because their hands are tied financially and I can only do what I can do. Um, it's also the hardest and the saddest part of my job when I'm faced with those situations. The other part of challenging for me, the other challenging part of my job is animals that don't want to be seen, where they need to be seen, but they are so fearful and or they are so aggressive, and I have to like literally. Some of them I'll spend an hour just sitting there talking, slowly inching closer, 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 closer to them, knowing that if I can get close enough, that I may be able to at least touch them to like give a little shot so that you can go night night. Okay. Just do something so that I can make a difference and not feel like I have to leave this animal as sick as he is, or she is. Um, the most rewarding part of my job is that every single day is different. There is no routine. There is there is no set like, okay, I have to do this and I have to do that. No, no, no. I I have a schedule, but I don't always keep that schedule. And I love getting the phone calls. Hey doc, can you come by and see? Oh my God, I haven't seen that dog in forever. Yes, I'm coming by. When I get out my car and I come to the door and I get knocked down almost to the floor by the dog that is so happy to see me. It's like, girl, where have you been? I've seen you since last year. That makes it just, to me, it's like I love other people's pets as much as I love my pets. And so the rewarding
That's
part,
my dogs. They meet
see,
you once, they will never forget you.
yes. And there's
They
nothing
will
better
knock you
than
down.
that whole butt wag of, hey, hey, you're here. I love you. Hi, come see me. It is wonderful. And so that's rewarding to me. Everybody thinks that, yeah, you play with puppies and kittens all day. No, I play with little old gray-faced dogs that can hardly walk, but when they see me, they get up like, wait a minute, girl, I'm gonna come to you. I'm coming. Here I come. I'm gonna come say hi. And that it's just that warms my heart. So
I could definitely see that. I also wanted to say for the participants who are here, for everybody who's here in the meeting, if you have, if a question pops into your head, please feel free to put it in the chat or raise your hand, and we can interrupt these. I have a fairly long list of questions that were pre-submitted, but we can interrupt them anytime. So please feel free to let me know. Just if you could put something in the chat or raise a little virtual hand, that would be amazing. So then let's see what's next. You've already answered a lot of them. Here's a good one. What tools or equipment do vets use? Probably pretty
um
similar in a lot of ways to what people doctors use, but
yeah.
go
So
ahead.
as a small animal veterinarian, I would say that for me, my tools and equipment are, of course, my stethoscope. Then I have it's a set that is an ophthalmoscope for looking in the eyes, an otoscope for looking in the ears. Um, I also have I use pleximeters. I use things for, checking range of motion with joints, joint angles. Um, the one tool that I break out that nobody likes is when I break out my tape measure because I had come to see my dogs that are overweight. Okay, come on, let's see, where's our waist? And the owners really get upset with me about that. Like, Dr. Jordan, he's just big bone. No, no, he's not, but we're gonna call him big bone. Um, and then for me, also my acupuncture needles are my tools. That's another thing that I use as a treatment protocol. So using the needles, other like in large animal medicine, a lot of that is using more like means by which to corral the animals and to hold them into one space. And um, exotic animals, when I did a stent in exotic animal, that was again a whole different thing. It was using different bags and things to catch animals and put them into.
Do you want to explain? I'm sorry to interrupt. Explain. I don't know if I hadn't already had this experience with my son's hamster, I wouldn't know what an exotic animal vet is, because I don't think people might think you're talking about, monkeys and,
All right.
so just
Yes.
really briefly, maybe explain what that is.
So in small animal medicine, there's an exotics department. So the exotic small animal medicine is basically, these are going to be the birds, and these are gerbils, hamsters, guinea pigs, rabbits. We call them pocket pets, iguanas, all of those little pocket pets that you see in the pet store, those fall under the category of exotic animals. And that is not something that I was trained in. That's a whole different training. So for me, I was just regular small animal, but a lot of people love exotic animal medicine. And so there is a veterinarian that just does exotic animals.
I learned that during COVID with my son's hamster. Uh, what emergencies require immediate vet care? Why? Why would
There's
you need to bring your cat or your dog to an emergency vet?
okay. So I would say it starting from the top, like here in Georgia, it gets really hot. So anything that resembles heat stroke, like the dog's been outside for too long, he's panting, he's recumbent, he's not looking good, that is an emergency. We're get him in the car, put the air on, get him there. Um, Unfortunately, with dogs, we do see a lot of foreign bodies. And a lot of the foreign bodies that I see, believe it or not, are I think the dog ate my sock. I think the dog ate this. I think the dog ate that. When I was doing surgery, I did surgery on a pit bull who ate no less than 35 pennies that I had to remove from his stomach. Why he didn't stop at one, I have no idea. So the emergencies are always going to be foreign body ingestion. The emergencies are also going to be toxicities. If there's one thing I will tell you is um, learn, and there are several websites that you can go to that tells you what is toxic to dogs, because it's not what you think, and sometimes it's, well, he can have that. No. And I say that because a lot of us, what do we have? We have a lot of flowers in our garden. We have a lot of flowers in our home. A lot of flowers are toxic. Okay. A lot of lilies are toxic. And the same thing with the big thing that everybody loves, chocolate. No. Chocolate, especially dark chocolate, is toxic to dogs. Another thing, believe it or not, grapes and raisins are toxic to dogs. So if they have eaten those toxicities, they need to go to the emergency room because unfortunately they need to have vomiting induced, and then they need to have activated charcoal to coat their stomach so that they don't absorb the toxins. Trauma, 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 trauma. It's between unfortunate, unfortunate. I didn't see the dog. I didn't see the cat as I was backing out the driveway. Too many of those. I've seen too many of those. So any kind of trauma, hit by car, if your animal comes running back to you and it looks like something happened, it probably just narrowly escaped getting hit by a car, but got nicked enough that there is trauma. We go to the emergency room. Okay. Um, can't leave out dog fights. A lot of people are like, well, yeah, we were at the park and I don't know, it looked like they tussled, but I don't think anything happened. And then later the night, like, okay, my dog's not feeling well. Oh my God, look at that puncture. Look at that. Especially dogs with long hair. If there's a confrontation and your dog had a fight or was some kind of if it wasn't really a true dog fight, but there was a scuffle, you need to check them. Okay, because bite wounds can get infected really, really fast. And then I always call it the silent ones. The silent ones are if your pet is just laying around. And you're like, well, then why are you laying? That's not like you. You don't do that. Well, you didn't eat tonight. What's going on? Those become the emergencies because those are the ones that time is of the essence. because they either got into something or they're not feeling well and they need to be seen at the vet clinic so they can get assessed and treated.
I'm starting to come up with all kinds of questions that I want to ask you as a veterinarian, but I don't want to get off topic that this is career oriented. I'll have to call you afterwards. One question that came in today, and I think this is one of our registrants, or one of our participants submitted 3 questions just this afternoon. And the first one, I think, is probably going to be difficult to answer because it's how much money do you make as a veterinarian? I think that's going to vary so much by what type of doctor you are, what region you work in. So many things will impact that, but I don't know if you feel like it's possible to give any kind of range.
You know, and it really does depend. Like here in Georgia, there are like new graduate veterinarians that are making like 150,000, but they're working for corporate medicine. Regular traditional veterinary clinics, unfortunately, are being bought out by corporations, and so that is a whole different problem that we have in the veterinary profession now. But as you go into the further your education in veterinary medicine, so if you have now, we call it, you're a diplomat and you're a diplomat of veterinary internal medicine, then you may be at a veterinary school teaching. So now you're a veterinarian who's teaching. So it is a wide range, you know, from academia to, you know, the veterinarians that we have a place here called Blue Pearl. It's a specialty practice. You know, we're talking hundreds of thousands of dollars there. So
we have a Blue Pearl here.
Yes, they are everywhere. But it's, I mean, so to put it this way, you can make money in veterinary medicine. Are we paid the way MDs are paid? No.
Oh, that's surprising to me. I did not know that.
No. Veterinarians do not make,
even though your job is probably harder.
Yep.
And you have to learn so much more. That's very interesting.
Yes.
I think that you've answered this, and we probably know the answer, but the next question was, do you have to work with blood? And well,
Yes.
you are a doctor.
And
so.
you know what? I'll answer it like this.
How much?
Yes. How much blood? If you're okay drawing blood to get a blood sample, you're good. But you have a veterinary technician. You do everything and you have your veterinary technician draw the blood. I had classmates who decided they never wanted to do surgery. And the reason was because they didn't want to see blood. And so they are amazing, but they never do surgery. They never touch surgery. So if you want to be a veterinarian, you do not have to do surgery. You may have to do a surgical rotation, but when you get out in your career, there are so many veterinarians who never did surgery once they graduated from vet school. And now with the licensed veterinary technicians, let them do all the blood draw. You don't have to do that either. You can find a way around that.
Interesting. I wouldn't have thought that. So that's all the submitted questions at this point. Then I would just say again to the audience, if there's anything you would like to say, if you have any comments, if you have any other questions of your own, please even feel free to shout them out. This person is an incredible resource for us, so let's take advantage of her. Milk her for all the information she's worth. All right. Well, if we have no other questions.
I have a question.
Great, thank you.
So for Dr. Jordan, and by the way, Dr. Jordan is my auntie, everybody. I have a question in regards to you decided to go into medicine to drew you into going more into the holistic approach and kind of like knowing the difference between that and the medical. I know some students who are working in the medical field, you can go in holistic medicine as well too. So what is, what was kind of your drawing on to holistic medicine, working with animals?
I like having tools in my toolbox. And what I realize is once you have that baseline, and for me, that foundation of veterinary medicine gave me everything that I needed. I wanted to be able to offer something different. I've always been drawn to some things that are a little out of the realm of what I would consider traditional veterinary medicine. So right now, I decided to learn acupuncture when I started my house call practice. And it gave me another tool, again, for animals who are sick, for animals who are struggling with pain. They may not be able to handle medication correctly. They're older. Acupuncture, it's been around for centuries. It is a proven medicine. It is a proven modality. And it's another way of helping animals to have what I consider a good quality of life. The other thing I'm in the process of learning now is something that's called classical homeopathy. So again, it's another modality for treating animals where there are animals just like people who are sensitive to drugs. I can't give you a drug, but I can give you this. I can't use this one, but I can use that. So always having another alternative treatment protocol for animals who can't handle the, routine treatment. That is why I got drawn to the holistic side, because it's a gentler way of practicing veterinary medicine where they don't need all the testing, they don't need all of this, they don't need all of that. They need supportive care to help their body heal. And that's what these modalities do.
It's wonderful.
Thank you.
I wonder if anybody who has a pet at home would like to turn their camera on and share their pet.
Oh, that would be cool.
I'll get us started. I'll get us started. Here's one goofball right here.
Oh my goodness, look at that love.
This one is 2.5.
Oh.
All right, and here is my other goofball, who is 12.5.
I see
Very
that gray
proud of him
face.
for being 12.5.
Yes. Those are my kids. I love the
like,
gray
why
face.
are you bothering me?
Leave me alone, Mom. I love it.
Right?
Ah, fantastic. And never tire
I
of
guess
seeing.
I'm the only one who's obsessed with
I
them.
know. But that's okay. Thank you. I'm glad I got to see them. That was cool.
Yeah. Usually, the younger one, Kofi, is pushing his way into the Zoom meeting, so he's been very quiet tonight. So. Well, unless there are any other questions, I will thank you so very much for being here tonight.
Thank you.
We may pick your brain and hopefully have another session with you another time. I know every year we talk to kids who are interested in veterinary medicine, so it's wonderful to have a contact.
Yes, very good. Thank you.
You're very, very generous with your time and your experiences tonight.
Thank you. It was so good to be able to share who I am and why I love what I do. So thank you.
You're clearly passionate about it. You're definitely in the right field. You remind me of at my old school, I ran our Hall of Fame, and one year I interviewed Jennifer Baltimore, who is she's an entertainment lawyer. I always have to remember what is the phrase, and she told me during our interview that she knew from, oh boy, now I can't remember the name of the show, one of those old-timey, like black and white lawyer shows, but she knew from when she was like 5 years old she was going to be a lawyer. And I mean, that's something. But yeah, it's rare, but you seem to be one of those people who just knew.
Yes.
It's a good thing. It's a blessing.
Thank you.
All right. Well, thank you to Dr. Jordan. Thank you to our Miss Jordan for making the connection, and I hope everybody has a wonderful evening. I will be processing a recording of this, and she will share it out with everybody as soon as it's ready.
All right. Very
You're
good.
getting a lot of applause. I don't know if you can see.
I see the hands. Very
All
good.
right.
All right. Bye-bye.
Bye-bye.